In the last couple of years, some private hospitals were in the limelight after it emerged that they had defrauded NHIF through fake medical claims. According to EACC Chairman Archbishop retired Eliud Wabukala, universal health as promised by the government is very critical to the country. He praised NHIF for ongoing reforms while condemning institutions and individuals who have been benefiting from the fake claims.
I think that's part of the problems we are going to address together. And we normally, when we receive those kind of reports, and that's what Chair was trying to allude to, we follow them up and to establish exactly where a public servant is involved in that fraud. But again, it comes to what my brother has asked, public awareness. The fraud is happening between a hospital and a citizen, who are private citizens. And therefore, our public education awareness is geared towards making the Kenyan know that participating in that is just making health very expensive. And of course, doesn't help all of us. So those issues, when they come, we address it, but they are significant. And I think all of us, including our partners who are in the media, because we are part of our very senior partners, we must bring these things out openly. So NHIF is one of those very significant partners in our quest to deal with corruption from the ethical part. We want to see a changed culture. We want to see whether people at the board level of management for institutions embrace this culture change. And as you know, when it begins at the top, it rolls down to every person in the organization.
Wabukala noted that the fraud was making the provision of health services expensive, thus affecting millions of Kenyans who could not pay.
Health was one of the pillars at independence that Kenyans identified. Of course, education, health and poverty. And that makes NHIF the most important institution in this country to address that aspiration of Kenyans. And that's why EACC looks at NHIF as our very important partner. And we have promised to continue working with them, helping them see how to inculcate this culture of ethics, of honesty, of trust, among the top leadership, and so that we can help their services get down to every Kenyan.
On his part, NHIF Chairman Lewis Nguyai admitted the fake claims were there, but was quick to add that this had been addressed through the introduction of biometrics for all members. He warned that any facility found to have presented fake claims face a 3-year ban, while the management faces prosecution.
Medical insurance claims come in fake form. But I want to give 2 milestones where we have really fought against those fake claims. And in August of last year, it was August of last year, we concluded 100% the biometric registration. So in nowadays, you don't need to even have an NHIF card. When you go to a facility, the first thing they do if you haven't registered as a member of NHIF, yet you contribute as a member of NHIF, is to take your biometrics. And it is taken in all our branches, but it is also taken in the hospital the first time you visit if you've never utilized our service. That has in essence curbed that issue of impersonation, of bringing somebody who's not a member to get the services of NHIF claims.
Wabukala was addressing the press at Lake Naivasha Resort during training of NHIF board members on integrity. Kind Stefano, Airbri TV.